minimum 3. I got a book already. Good thing I came back.
Yeah.
We have the grandkids over. You know, we got 3 of the grandkids, and they're home. School from home, virtual, and she's still working. It's good that I'm home when a lot of times I'll just work remotely on Mondays and Tuesdays if we have them, so that I can give her a break. But she's not. For a long time she had little kids.
Oh, little ones.
Well, 14. The boys are 14. That's everywhere. But the 14-year-olds they're twins, so they're constantly messing with each other.
Yes, I have twins.
Oh, you do?
Yeah, I have daughters, girls.
Cool.
Yeah, the first one was born and the doctor said, oh, I think there's another one in there.
Uh-oh.
That's how I
You also
found
have
out.
boots.
Boy.
Yeah. Well, I guess it's 4:31 weekend.
Yeah.
Good afternoon, everyone. I will call the meeting of the Human Services Committee Board to order. Let's see, we do have 3 of us here. That is a quorum for this committee. We did. Now what?
She was muted. We didn't have a pick. She didn't have a pick for some reason.
Well,
Maybe she's trying to recall
we
it.
don't have any items that need a vote, so I'm assuming we can still proceed,
Oh,
right?
excellent. Oh, okay. We're okay.
All right, okay. So then, my affidavit of posting. This agenda was posted in the office of the county clerk on the 9th day of December 2020. Notice was sent to the West Bend Daily News, Express News, WIBD, WMBZ Radio, WTCAM Radio, My Community Now, Hartford Times Press, Kewaskum Statesman, and the Milwaukee Journal Sentinel. Would you please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, the first item on the agenda is our consent agenda. I am going to pull out the ADRC information and assistance supervisor position, as well as the Health and Human Services Director's report. So for the consent agenda, then it would just be the minutes and the Samaritan campus update, unless still no Lois, Don wants something else pulled out. You're good? All right, then I'd entertain a motion to approve the consent agenda with those 2 items. I'll second it. All those in favor signify by saying aye. Aye. Opposed, and that motion carries. Okay, Lois, you're on. Thank you. Then we will take up the ADRC. Tammy, you wanted something? You wanted to say something?
Can you hear me?
Yes.
Okay. I just wanted to introduce Alyssa Gresh to the group. Not a very big group today. But Alyssa was promoted recently. The title is ADRC Supervisor. She'll be supervising 5 other information and assistance specialists. So I thought it'd be nice to put a face with a name, and Alyssa can tell you just a little bit about herself.
Oh, wonderful.
Hi, happy to be here. I've been with the county for 7.5 years. So I started as a temporary economic support specialist after the Affordable Care Act passed, and they couldn't get rid of me. So they then hired me on as a permanent position. So I was with economic support for about a year, and then I've been at the ADRC for a little bit over 6 years. So
Okay.
happy to take on the challenge.
Is this your first supervisory position?
It is.
Well, congratulations on that. And good luck.
Yeah. So far, so good. It's been 3 weeks. I'm doing an amazing job.
That's great.
Oh, yeah.
Okay.
That's my names.
Never can tell who's under that.
Yes. Yeah. Well, it's nice to meet you both.
All right. And then the Health and Human Services Director's report. I do have, Julie, can you please talk a little bit more about that Suboxone clinic, please?
Yes, and I apologize, Supervisor Dice. I updated the report after our conversation, and some of it's updated as what I wrote, and
Yeah,
then
I
some of
noticed
it's not. So I'm like going through all my materials now to find out what happened. And so you just want me to describe that a little bit more?
Yeah, that was completely new to me.
Yep.
Even
Yeah, and I wrote a whole 2 or 3 more paragraphs. So Suboxone is a medication-assisted treatment for individuals who are dealing with opioid use disorder, or or addicted to heroin, as many people often know those words. Currently, at the Human Services Department, we offer Vivitrol, which is a monthly injection. I think we've had a lot of conversations at this committee level about Vivitrol, so there might be some more familiarity with that. Vivitrol is also used in our jail program, where we're administering Vivitrol prior to people being released from jail, in efforts to help them in their treatment and recovery. Suboxone is a pill that is prescribed. It's a daily pill. They come in to see the psychiatrist, starting off weekly and then going to every other week, and then to monthly as they further along in their treatment. Suboxone also is available in an injection formula. It's called Sublocade. And so to be evidence-based and to adhere to the best practices for medication-assisted treatment, it's recommended that a clinic offer more than one type of medication-assisted treatment. And so we've been receiving the state opioid response dollars. This is our 3rd year. And that's one of the recommendations of that funding, is that we, start to adhere to best practices. So we've been working on this with our prescriber, Dr. Christian, for about the last year to set up our clinic to be able to provide that type of medication. So we're very excited and thrilled that was able to start in July, and we've served 11 additional clients through that medication-assisted type of treatment. And we've been working with a lot of our community partners. So there's some other clinics in the community that offer that. And so we are really only serving those who their insurance will not pay for it. And then we pay for that through the state opioid response dollars.
Thank you. And I do want to compliment you on that just-in-time scheduling as well. I know that has historically been a problem, trying to get people in quicker. And so it's nice to see that you've accomplished that. So terrific.
Yeah, and we've been, we had a lot of success with our same-day access. It was, we had to stop same-day access for several months during COVID, but we were able to start that up again. And so that was, a huge effort on the part of the department and of the behavioral health division. And so we were kind of sad to put that to the side during COVID. So happy that we were able to restart that.
Yes, that's great. Okay. Does anyone else have any questions? Lois, if you do, how does that work with this system? How do we know if Lois has a question? Can she let you know somehow? Cool. All right, we don't see her. So if she's raising her hand, I don't know that.
Lois, if you can hear us, could you unmute and speak to us?
Okay, I think I'm unmuted now. Can you hear me?
Yes, now we can.
Yep, okay.
Thanks.
And I can leave it unmuted if you want.
I'm sorry, what?
I'll leave it unmuted. I'll keep the audio on.
Oh, all right, fine. Do you have any questions, On
I
either,
did not, you answered the question. I had a question about that same thing.
okay. All right, great. Okay, then we'll go on. Do we need to approve those two items then separately from? Okay, all right. Then we're on to the discussion items. The first one being the Brighter Futures funding. Are you going to address that, Julie?
So I wanted to bring both of these grants forward to the Human Services Committee. They are not required to be approved. There's no resolution needed. Per the county attorney, this falls under the standard grants because we have received these grants before, but I thought it was really important to bring forth through the committee to just make you aware that we did receive these two grants. This first one, the Brighter Futures, is a second round of funding from the state, but it is for 3 years and it's $225,000 for $225,480.81 each year for the next 3 years. This project is a partnership with Elevate. And 3 years ago, when we applied for the funding, we proposed to do a shared services with Waukesha County, both so that we could have a greater reach for youth between the two counties, but we also thought that that would make the proposal that much more competitive. And they, Elevate has done a fantastic job the last 3 years in providing these prevention and intervention substance use disorder type of services within the school systems, both in Waukesha and Washington County. The state has been very thrilled with their level of service, and we were excited to have been refunded through this proposal for an additional 3 years, and the funding actually increased by about $40,000 from the previous 3 years. So I think it's both a great testament to the partnership we have with Elevate and their work that they do with the community and with the schools, as well as, you know, being innovative in making our grant proposal competitive and crossing over 2 counties.
Okay, any questions from anyone on this? Is this kind of a peer-to-peer?
Yeah, they have a number of different programs that have different names. You know, they have Too Good for Drugs, Peer for Peers, a number of different programs, and they reach various age levels, and there's various types of programming. Some are your sort of more traditional sort of class type of programs. Some are peers, supporting peers, and they've, you know, both. You know, what we know about alcohol and drug prevention is obviously the younger that you can engage kids into that, the better outcomes you're going to have. And so they've really been able to expand both in the middle school and down to some of the elementary schools. And then the peers program is really, you know, more into the high school age. And so they've just had a lot of success. I know 3 years ago, you know, they weren't in as many schools as they are now, and they've really been able to get those doors open for the schools and provide that service. It's challenging for the school districts because some of the time that they're asking for is instructional time. And so for the schools to sort of figure out how to allow a third party provider to come in and figure out the time to let them do that programming does take an effort on part of the school. And so there's just been a huge increase in collaboration over the last 3 years around that.
Okay, great, thank you. Okay, then we're on to the state opioid response funding.
Yep, and so this again, I think is very important just to highlight and bring forth to the committee that this is our 3rd year of the state opioid response dollars. And this funding has been instrumental in our ability to increase the level of services and treatment services for individuals. I mean, especially as we grow our programming in the criminal justice system, and our criminal justice system acknowledges and understands the need for treatment versus you know, sort of just putting people in jail. But then those folks actually need treatment. And so we need, you know, the funding and the dollars to be able to do that. And so this funding has been very instrumental for us in not only standing up our Vivitrol program and now adding on to that our Suboxone program, but then also being able to fund actual treatment for people. So whether it's an outpatient program or whether it's a 30, 60, or 90-day residential inpatient program, generally the county has been responsible for funding that, and this funding helps us to offset those costs as we try to divert more people into treatment rather than into jail.
That's great. Any questions on that? Nope. Okay. Well, it appears you've done a great job. Nobody has questions. so-
Great.
All right. Well, that's our agenda for today. Our next meeting is scheduled for Wednesday, January 27th at 4:30 p.m. There being no further business before this committee, we stand adjourned. Thank you, everyone.
Thank you.